Thank you very much. Good day again to all the participants, to the guests and the chair who have joined on today's call for the conference. Thank you for giving us the opportunity to present our paper. Krithika Ravikumar and Hannah Anush are the authors for the paper titled Revitalizing Motivation for Healthcare Office Workers, an analysis of the job diagnostic survey through the lens of Hackman and Oldham's model. Talking about motivation for healthcare office workers, when we reviewed recent studies that have been published, there was a lot of work that had gone into healthcare workers, but physicians and nurses, healthcare workers who directly worked with patients. And oftentimes, we struggled to find publications or articles about healthcare administrative or office workers. So that is the why of the study, because we wanted to look at healthcare office workers, the stress levels that they are processed through, and look at motivation that can help them to succeed and be more efficient in their work, because they also support patient care, but indirectly. So, looking at healthcare office workers, they work in a high stress environment, supporting patient care indirectly. They require high levels of accuracy, and time and cost sensitive work is what they do. They also handle secure data in the hospital realm. They handle patient data, handle billing data, and a lot of information about patient health is also handled by healthcare office workers. Thus, they indirectly support patient care, and they have increased levels of stress, and the post-pandemic effect has taken a toll on healthcare office workers also. We used the Hackman and Oldham's job characteristics model to understand the motivation of healthcare office workers. So this model has 5 broad categories that is used to collect data from respondents to understand their motivation levels. So the first category is skill variety, which is nothing but the degree to which a role or a job requires diverse array of activities to carry out their responsibility. What are the variety of tasks that will be needed to do the activity? And the second one is a task identity. The task identity is characterized by the degree to which a role or job requires the completion of discrete and identifiable pieces of work. In other words, completing a task from start to finish with tangible outcomes leads to task identity. Task significance. It pertains to a measure in which a job exerts a substantial influence on the lives of the work of others, including both individuals within the organization and the broader societal content. These three categories relate directly to the task, whereas the fourth and the fifth category, autonomy and feedback, relate to the management of the job. Autonomy, being the fourth category, means that the level of freedom and discretion granted to the employees in managing the work. And the final one, feedback, is feedback in the work setting focuses on receiving direct and unambiguous information regarding the efficacy of their work performance. These characteristics impact 3 critical psychological states: experiencing meaningfulness of the work. Employees are more likely to be satisfied and motivated when they find meaningfulness in their work. Experienced responsibility for outcomes of their work. Employees are more invested in their work quality if they are personally responsible for the outcomes. And knowledge of the actual results of the work activities. Understanding how one's work contributes to the end product or service can significantly increase motivation. The motivation potential score was used in this research, and this is some information about the MPS, which is the motivation potential score. The MPS provides a combined estimate of the overall motivational potential of a job based on the core dimensions of the job characteristics model. The below is the formula that was used to calculate the MPS in this survey, and all this information has been taken from the Hackman and Oldham's theory of motivation. Healthcare office workers and motivation outcomes. When the motivation is induced into the healthcare office workers' daily life and work, we see a lot of tangible outcomes. High levels of job satisfaction and high quality of work, low turnovers, employee retention is possible with motivated employees. Greater engagement, deeper commitment, overall enhancement in the facility. It the motivation leads to motivated employees, that leads to high efficiency and effectiveness of the facility or the organization itself. It develops the entire organization. Self-awareness leads to experience a deep sense of meaningfulness, responsibility, considering the vital role they play. Motivation helps them to identify better with the job they do, be aware of the outcomes that affect patient care, and make them realize that the job they do helps a patient indirectly. That creates a lot of motivation for healthcare office workers and administrative workers. Assistance in designing jobs that not only enhance motivation and satisfaction, but also support superior patient care. The post pandemic era has led to high stress environment for healthcare, and leveraging motivation will ensure attracting and retaining talented employees. Moving on to the study. This is a relatively small study. The study investigated the dynamics of healthcare office workers in a North Texas hospital using mixed data collection methodology to examine the motivational potential of healthcare office workers using the Hackman and Oldham's job characteristic model. The total population was 300 employees, among which a sample was selected based on their tenure in the organization and their role in the system office department. Physicians and nurses, professionals who directly worked with patients, were excluded from the study as motivating factors and the nature of jobs substantially vary for both groups. The study uses a 5-point Likert scale to measure intrinsic factors impacting motivation and job satisfaction and reflect healthcare office workers' perceptions of these job characteristics in their roles. Overall, the research seeks to identify which aspects of job design could be improved to enhance employee motivation in healthcare administration workers. After the data collection and processing of data, these were the results that we arrived at. And the results are under skill variety, task identity, task significance, autonomy, and feedback, the 5 categories we used to collect and process data. Moving on to the findings of the results. The task significance was scored at the highest, 4.14, indicating a strong awareness of the employees' roles in impacting patient care and satisfaction, which means that the employees understood that the role that they play is significant and important, and their deliverables are important, which motivated them to perform better. The management has been an effective communicator of the service mindset that is required for healthcare professionals to succeed in their roles. If we look at the other result, autonomy is identified as the relative area for improvement with a low score of 3.20, indicating a need for creating opportunities to increase decision-making freedom for employees. Hybrid flexible work schedules may help in improving the autonomy scores, as most of the respondents raised their concern over the in-office arrangement. The motivation potential score of 41.15 implies the job of the healthcare office workers lies within a moderate to high motivation range, which emphasizes the criticality of the job design in fostering employee motivation. This study did have some limitations. As I previously mentioned, it was conducted in a single healthcare institution in North Texas, and we were unable to collect data from other organizations due to hospital privacy policies preventing acquisition of data from a wide range of healthcare facilities. So, a future extension of the study could be collecting more data from other healthcare organizations and understanding motivation in a bigger picture. The data collection hindrance limits the generalizability of findings in comparison to different healthcare environments across multiple organizations. The results may vary across geographical locations that have certain advantages and disadvantages that might lead to varied scores. The study's cross sectional design precludes the ability to establish causality between levels of motivation and job characteristics. Moving on to our recommendations. Incorporate longitudinal designs and gather data from diverse healthcare settings to enhance the applicability and robustness of findings for future research. And differentiating respondents into managerial and non managerial roles may uncover new findings, as the motivation factors may vary for both groups in terms of significance autonomy. We also understood that the respondents belonged to managerial and non managerial employees. So we wanted to suggest a future study where only non managerial employees would be respondents, or a sample size where only managerial employees would take part in a study to understand how our results would vary. Conclusion. The study aimed to assess the job characteristics influencing the worker's motivation, job satisfaction, and performance. The study's ultimate goal is to identify effective strategies to sustain talent among healthcare office workers versus the strategies requiring refinement. By collecting data, the study was able to discover the strategies for job redesign and organizational intervention that could boost the motivation of healthcare administrators, which will positively influence the quality of patient care, healthcare delivery proficiency, employee retention, and overall exhaustive adeptness. As the healthcare industry continues to evolve, especially in the wake of the pandemic, leveraging these insights becomes indispensable for attracting, motivating, and retaining skilled professionals in the high demand healthcare sector. Thank you.